Hi, my name is Arthur Baghdanian. I'm a diagnostic radiology resident physician at Boston Medical Center. As far as cancer patient care is concerned, one particular obstacle or challenge I think that we face today is the way we analyze as well as compile cancer patient information. And by information, I mean the various variables that we analyze to understand cancer as well as to figure out ways to treat cancer. Now, for example, when I do a research project as a radiology resident, I usually will have to go through patient charts and files to compile the variables that I feel are necessary. Sometimes in hindsight, I'll realize I'll see patterns that I initially hadn't thought of, and I'll add in an additional variable. And I wonder to myself, is it possible that we could potentially be at the level one day where we could take a patient's imaging as well as their epidemiologic factors, as well as their pathologic, histologic slides and specimens, and be able to compile a large database on a national level where through advanced computing we could see some of these patterns that we find we may be missing, or that may be shown when we have much more larger volumes of data that will show us trends that we hadn't initially perceived. The question is, why do we care specifically about this sort of data, other than the fact that larger volumes will increase our statistical confidence in making certain conclusions? One thing is that less invasive therapies are, for obvious reasons, becoming more and more popular. There's examples of tumors that could be treated now with oral medications. For example, gastrointestinal tumors are treated with Gleevec, which is an oral medication that takes advantage of some of the tumor cells' chemical signaling properties. Another example is thyroid ablation, where we use radioactive iodine rather than just sending the patient to surgery. We can ensure that a lot of the thyroid tissue within their body is completely ablated. The question becomes, how can we really achieve this goal? And I think that with the advances we made in technology today, if we were able to link multiple hospital systems together in order to compile this information in an automated fashion, when we know a patient has cancer, for example, or the initial imaging is obtained, then that will provide us with a very valuable database that will, through advanced computing, help us hopefully predict certain patient outcomes. Now, as far as my field is concerned, I think there are certain cancers that characteristically, based on their imaging features on MRI or CT, for example, we can confidently say that this is hepatocellular carcinoma, for example. However, there are other tumors that we need a tissue diagnosis. And I wonder if we could reach the point in time in the future where we're actually comparing the morphologic three-dimensional model of a particular tumor up against some sort of, a good analogy would be facial recognition software against other tumors, and it would give us an increased imaging statistical confidence with what sort of tumor this is, and maybe even prevent the patient from necessarily needing a biopsy and can go straight to whatever treatment they need to treat the cancer. So therefore, in conclusion, there's obvious advantages to using the advances in technology today to compile data from multiple different centers across the U.S. in order to be able to give us as physicians a better understanding of certain patterns, or and also allow us to make certain predictions about what type of cancer it is and what's going to happen as far as the patient treatment is concerned in the future. And the last thing would be to be able to compile enough data with a genomics analysis from that perspective in order to be able to come up with new therapies for cancer patient care. Thank you.